what the government is doing about the cost of dialysis and all the matters that have surrounded this particular process. Hello, good evening, sir. Welcome to Eyewitness News. The government surely should be concerned that, patients, kidney patients or patients with kidney difficulties are unable to fund their dialysis, and especially recently when the prices were hacked. Of course, we understand Korle Bu is being shut down. That actually constricts access. What really is government doing about the situation as we have it?
Yeah, good evening to all journalist listeners and viewers. Yes, recently we have had a lot of discussions about end-stage kidney diseases or kidney diseases generally. And it's a conversation which is going on, that it has brought forth what we are supposed to do as a country to make sure that access to health care by patients who have kidney diseases are clearly done in a way that we have sustainability in our system and also the care of everybody in our system. If you look at it, it's not end-stage kidney diseases. It's not only about dialysis. Dialysis is one of the management of end-stage kidney disease. And dialysis is generally very expensive, irrespective of wherever you are coming from. Most of the things you use for dialysis are used once and disposed. They are disposals. And all the things that you use in dialysis are all imported into the country. And the problem is not because the price has generally increased, not because maybe Korle Bu or any other hospital is increasing the price because of that they want to increase the price. But from what I've heard and what I've seen, and also what we have realized from the hospitals, the price of dialysis, if you look at it in dollar terms, have not changed much over the period that, for example, Korle Bu started doing dialysis. What has caused all this then is mainly because of the foreign exchange regime and then what has happened over the period of time. Because if it is tax, there is what we call the tax exemption regime, that if you are bringing in any medical consumables and medicines and non-medical consumables into the country to be used at public health institutions, you can adverse yourself to the tax exemption regime, which most hospitals do it, and when you bring in things, you can be paid for. But the most important thing is that if you are buying something at $20, maybe at the rate when it was about $6, 6 cedis to $1, if you are buying the same thing now, it's about double. So that's a fact. So what you do as a country, what you should do as a country is look at holistically how the whole treatment of end-stage kidney disease is all about. The Ghana Association of Ghana Kidney Association has been dialoguing with us. I've been to about 3 of their meetings, and we will look at holistically what it involves in the management of renal cases. One, what are the causes of all these renal cases that you're having in this country? Is it going up? How is the burden like? What are the treatments available? What are the preventive measures that we've put in place? And what is the treatment that we are using in this country? So you have to look at all of these things as a whole, holistically. So if you look at it, we start from first, what are the issues? End-stage kidney disease not only in adults, but also in children. If they are in children, what are we doing for the children so that we can manage them and also prevent some of the diseases and make sure that those who unfortunately have it also have access to care and also can afford the care? If they are adults, what are the causes of end-stage renal problems or diseases in adults in the country? If you look at it, we all know, they've told us that from the statistics that we see in this country, most of the end-stage renal cases that we're having in this country, the predetermined factors or what is causing them is mainly in our hypertensive patients. The number of hypertensives are also increasing in this country. Yesterday, Ghana Health Service gave us a statistic since 2019, and you realize that it's going up astronomically. And also, sometimes it's also diabetes or a combination of hypertension and diabetes. How do you do it? The most important thing is that if you can diagnose, that detect, diagnose, and manage these patients who have hypertension, diabetes, or the predetermined factors for these diseases early enough, then they may not end up as end-stage renal cases or kidney diseases. And how do you do that? You can do that first by institutionalizing something in place that every adult should be able to check him or herself regularly, for nothing at all, at least once a year. What I call adult weighing. For example, when children are sick, they go for weighing not because they are sick, but when they are born, they know every time when they send the child for weighing, they want to see how the child is growing. We give all the immunizations and the advice are given to the mothers. The same thing happening to the adults.
Yes. So in essence, I mean, I heard you were encouraging the public to consider organ donation to help reduce the cost of renal.
I'm building my point.
Yes, but
so first and foremost for adults is you have to do proper preventive and health promotion measures, and that we can do it by what Ghana Health Service and the Ministry of Health have put in place. That there should be wellness clinics across the length and breadth of our health facilities in the country. So I can walk to any facility, maybe the month or the week or the day of your birth, to go and check yourself. If you remember, or if you can recall it, you will realize that when our brothers and sisters in the diaspora come in, sometimes they will tell you, oh, I'm going back because my medicals, it's time for my medicals. Every employer should make sure that the workers at your place at least will have a medical checkup once in a year, so that you can detect these things early enough and manage them. You may not even manage them with drugs, but maybe with lifestyle changes and also diet. That is one. And we believe, and we're talking to Ghana Health Service, the National Health Insurance Authority, that they should see if they can even add wellness clinics or one medical examination a year to their
but yes, everybody appears to be talking about the NHIS. But are we not overburdening the NHIS? Yet we are not funding it enough. I mean, we've actually capped, their resources. So everybody is talking about NHIS. In the past, we heard about, ministers and a lot of people calling for dialysis and all of that to be put on the NHIS. Are we not going to kill it if it's not dead already? We are not funding it enough, but yes, still we are putting everything on it.
Yes, I believe that the funding of NHIS from the national NHIL or NHI levy, that anything that you buy, you pay something on it for NHIL. And then also from premium and other sources. I believe that, yes, initially, what I'm talking about for the free medical screening for every NHI patient, it will be expensive initially, but in the long run, you will not get people with hypertension, diabetes, or going into renal failure where we are now asking that they should be dialysis. So the effect is better than if you don't do it at all. So people don't get sick, or people get to know this is their problem and solve it out, and then maybe they will not take very expensive medicine. So there's a lot of advantages to it. It gives people also the incentive, especially those who don't want to do the national health insurance, that they can go to any hospital and go and do. That's a motivation for them. So that should be looked at very strictly. And I know National Health Insurance is looking at actuarial studies about it and make sure that if they have to put it on. I believe that that's the way to go.
Yes, but no, we don't have all day. But I'm just interested in extracting from you what the president thinks about this. Really, it's because you speak to him, you advise him on those things. Is he thinking about improving funding to the NHIS so the NHIS can take on dialysis, or is he planning of setting up a fund specifically for this, or he will actually encourage the organ?
Don't let us just put all the money. It is what is happening now. To me, if you do that, it's a knee-jerk reaction. Don't let us put everything on dialysis. As I said,
No, go ahead, yes.
As I said, dialysis is not the only management of end-stage kidney. There's dialysis, and also there is the main management of chronic.
No, I get that. Of course, the preventive medical and all of that.
It's organ transplantation.
Yes, all of that. But the problem we have right now at hand is the issue of dialysis. But organ transplant itself, doc, organ transplant itself, it's very expensive, to start with. The management of the process, it's very, very expensive. So how many people can actually even do this?
Dialysis is more expensive
in the long term.
Organ transplant.
In the long term.
Because if you are doing dialysis, if you want to do proper dialysis, you have to do it 3 times in a week throughout your life. It's not the main treatment.
And how much does a transplant cost?
To move into transplant. Don't let us talk about the cost now. What we should talk about transplant is that we put the necessary legislative instrument in place, which we are looking at, and we want to make sure that the documents which are there at the Ministry of Health, they are looked at, and then we do the advocacy, and then it comes through cabinet and then goes to parliament to be passed. So we should get a law, a legislative instrument for organ transplant, not only for kidneys.
Very well.
But even for tissue, any tissues or anything that you take for human being. For example, for the artificial insemination for, assisted fertility, those who are doing in vitro fertilization, there should be it's part of it. The law. They're taking a human part, a human organ, human tissue, which is the sperm or the egg. So there should be a law. It should all be part of it. Cornea transplant, which we have people who can do it in the country. Liver transplant, which we have people who are learning how to do it. And then renal transplant, which people have started doing in this country by relative donation. So
Very
we
well.
know how to donate, selection, education, where you store it, who are the people who are fit to do it, and how you give to a patient. That is the ultimate treatment for most of the end-stage renal problems. Not that dialysis is done as a stopgap until you get an organ to be placed into your body so that you can clean your system. So we should talk about all this. So how we put it, and that's what the government is doing, that we look at the prevention, promotion, look at the treatment, early treatment of all renal cases, and then look at before maybe you get the person to dialysis, to have organ transplant, to have dialysis, which for me, at least children, we look at the way that you can see if children can be offloaded into insurance system, which is the NHIA, like we have done for sickle cell patients, like we have done for cancer patients, for breast cancer and cervical cancer, like we are doing now for prostate cancer patients. Why not children with, unfortunately, who for no reason, no cause of death, are born or so with renal problems?
Very well.
So we have to look at it holistically. But if we take Korle Bu has increased the dialysis, so everybody's talking about dialysis. They were doing.
That's what happens when there's policy failure, really. So these things you've talked about, one would have expected that they would have been done long ago, so that would have arrested this situation before it arrived.
Now, Korle Bu, we are putting up a urology center which can do have a renal transplant unit. But the law has to be in place. Komfanochi is doing something. You can do eye cornea transplants in Komfanochi, Korle Bu, Cape Coast, and Tamale. So if you have a few centers like University of Ghana Medical Center, Bank Hospital, and all these people have been training people, nurses, doctors, pharmacists to be involved in all this. So it's a holistic approach that we are doing.
Very well.
Policies are there. For example, there's a policy on the medical.
Doc, obviously, we need to bring you to the studio one of these days, so we have a comprehensive session on this organ transplant. We will do that because it's an area I'm particularly interested in. Very well. Thanks so much, Dr. Anthony Nsiah-Asare, Presidential Advisor on Health.